So welcome everyone to the NYU Langone Department of Neurology Adult Clinical Neuropsychology Externship Open House. We always like to take this opportunity to introduce trainees to the various experiences and activities within our training program so that they can review it and get familiar with it prior to application submission. So I would like to first just welcome you. I'll be doing some introductory remarks. My name is Chris Morrison. I'm the clinical, the externship training director for the tracks within the Department of Neurology. So I'll take you through a little bit of introduction about the program at NYU, and then our various faculty members will in turn discuss different elements of the training program. So first, just a couple of broad statements about the Department of Neurology at NYU School of Medicine. Actually, it has a long storied history in neurology and in psychology as well. Collectively with the Bellevue Hospital, you could even consider that the NYU Department of Neurology was the first, if not one of the first departments of neurology within the United States. Here we have Dr. William Hammond. He wrote the very first neurology textbook at NYU in 1867. So the first, text on neurological syndromes. And then shortly thereafter, UPenn opened up their Department of Neurology. They currently claim first, but I think there's an argument to be made that certainly we had the fledgling beginnings of our department prior to that. Fast forwarding through history to contemporary times, NYU continues to have a storied reputation. For the last 3 years in a row, our Department of Neurology and Neurosurgery has been ranked #1 in the nation. So we have a very rich and deep field of neurologists who refer to our service. So the patients that we get and the colleagues that we interact with are certainly top-notch, and that's something we definitely enjoy within our service. Just to give you a little bit of the overview of the structure of the Department of Neurology, the training experience that you'll have is, purple should be the Center for Cognitive Neurology. That's the Barlow Center that the extern trainees will have a rotation within. And then, of course, here with us in the Department of Epilepsy. And within the Department of Neurology, we have sort of a separate division of neuropsychology, wherein the colleagues throughout the department, we have sort of our home of our own people. So apologies to my Barlow colleagues that I didn't get purple for the very top item. So that's just to give you a sense of the different areas within the Department of Neurology and how the training experience encompasses 2 different separate services within our department. NYU also has a storied history in terms of psychology and the history of psychology and assessment. Certainly, perhaps you've heard in terms of the history of assessment, the Bender-Gestalt, and of course, we all know David Wexler began his career first with the Army and then over at Bellevue and developing the Wexler-Bellevue scale, which we know currently as WAIS-5. So this was the territory where the origins and some of the same test items, I fear, were developed here almost 100 years ago. We also have a storied history in terms of involvement and development of psych rehab and neuropsychological rehab within our Rusk Institute. And of course, in terms of psychophysiology, we have the early work of Hans Lucas Teuber. So NYU has quite a long history of being deep into neurology, neuropsych assessment, and on the forefront of developments in that area and clinical work. So it's quite a nice place to be. A quick introduction to the faculty. I already introduced myself. You'll be hearing from some of my colleagues through the course of this presentation. Dr. Rosenberg is our pediatric specialist. You will not be seeing her this evening, and I'll discuss why in a little bit. And then you see our Barlow colleagues and my other colleagues here at the Epilepsy Center who will be you'll be introduced to shortly. So first, we're just going to do a basic overview of the Manhattan campus. I believe Dr. Appleton, you're going to help us with that?
Yes. So I think so we're going to offer, I believe, 7 positions at the Epilepsy Center. Um, and then, as Dr. Morrison was saying, the pediatric position is not offered at the current time. Um, and in terms of what you would be doing as an extern, the focus is really on assessment, so consultation and neuropsych assessment. There aren't any intervention experiences or therapy at this externship, so we want you to have a really strong background in neuropsychological assessment. And if therapy is something you're interested in, that's great, but this might not be quite the externship for you for this coming year. We predominantly are working in person. So in terms of all of the testing, that's all done in person. We're not doing any remote testing. Occasionally, you may be like working remotely on a report or something like that towards the end of the day, but we generally require people to be in person for their 2 days that they're here. Um, and many of the feedbacks, I think we can kind of skip this part because the pediatric track is not being offered this year.
Right, but I do want to offer a supplement to the remote. We do in the adult side offer occasionally remote feedback, and the folks at Barlow will comment on their practices in a minute. Okay.
Yes. So in terms of what's required for the application, you have to be a part of a doctoral program in clinical psychology, either a PhD or a PsyD program. And you should submit a cover letter, your CV, as well as 2 letters of recommendation and a list of neuropsych tests that you've given and psychological tests through the wiki portal, which hopefully you all are familiar with, or you will become familiar with if you're doing externships in the New York and New Jersey area.
This is our last year of the wiki portal. Next year, it's going to be something entirely new. We'll see what happens. So that was a sort of a brief overview of some of the skeleton of the requirements and so forth. We'll move on to a little bit more granularity about the activities over on the adult side and especially on the epilepsy side.
Yeah, so you're going to be doing neuropsychological assessments, both in the inpatient and outpatient setting. You're going to get experience with multiple supervisors, Dr. Morrison, Dr. Rush, and myself. And we have a really wide variety of referrals. So not only are you going to see epilepsy patients, but also patients with various neurological conditions. So, TBI, a lot of neurodegenerative conditions, Parkinson's disease. We do DBS evaluations, tumor cases. So really the full spectrum of psych, anything you could imagine. We pretty much see it over at the Epilepsy Center. And people can have epilepsy for a variety of reasons. So you could, sometimes seizures are not like the primary referral issue for why somebody's coming to us. In terms of your days, you're expected to come 2 full days a week. And they would be any day from Tuesday to Friday. But because we have our didactics, which we'll discuss more later on Tuesdays and Thursdays, one of the 2 days has to be a Tuesday or a Thursday. The caseload is generally 1 evaluation a week. So you're expected to see a case, and then you're responsible for everything for that case in terms of documentation. So you're going to be writing the full reports. I know that's often a question. Maybe at some other sites, you don't get the opportunity or experience to be able to write the full report, but you would be responsible for, reviewing the medical record, making sure you have the relevant history, documenting it, as well as the interpretation of the data, and writing that up into a report. And then you would be doing 1 of those a week, generally. The reports range from like 1 to 4 pages around. We write short reports here, so you have to get really good at synthesizing information and putting it into sort of a bulleted format. So you're not going to be writing like long prose forever and ever. And you're going to get really good at finding out what information is key and going from there. So as I mentioned, you'll be responsible for your cases for reviewing their medical records in Epic. So if it's on the inpatient side, you might get a brief overview of the case before you see it from one of the fellows. But then afterwards, and after you've done the testing, you're going to delve into their medical record and get a fuller history from there. And if you see a patient outpatient, you would be responsible for reviewing their chart before the case, also in Epic. As I already sort of touched upon, the report styles are quite short. So if we see inpatient consults, which are not a part of the epilepsy service, so we see patients for heart transplant, liver, lung transplant, also psych referrals or disposition discharge planning over in the hospital. So those consults are shorter reports, like 1 to 2 pages. And we want to get those to our colleagues faster. So we try to like really target those evaluations to the referral question. And then we also, the other reports are, as I mentioned, also streamlined, but a little bit longer. I think there's another maybe bullet.
Yeah, I feel like, yeah.
Yeah. Around 4 pages, kind of depending on the referral question. And, you're going to get experience working with pre-surgical epilepsy patients and have a good understanding of making lateralization and localization statements, which is really good to understand neuroanatomy a little bit better as well.
Both of the textbooks in these 2 slides, this one and the one prior, they actually have example reports. So if you literally want to see what you're getting into, we're not ashamed to share exactly what our report style is. And frankly, the Dr. Donder's neuropsych report writing book is quite good. So you should have that anyway as part of your armamentarium.
I don't know if I'm supposed to cover this section, but I did sort of already discuss that there is a wide range of patients that we see, anywhere from 16 to 90. And because NYU neurology is #1 in the country, there are patients not just coming from like various boroughs and states, but also all over the country and from different countries as well to get care here. So it's really diverse in many different ways, not just socioeconomically and culturally. Also linguistically, we use interpreters. So you'll probably get experience working with an interpreter at some point over the course of the year. And so it's a really nice, diverse patient population from a really wide range of conditions.
Right. I think you shared earlier a lot of the diagnoses types that might be included. Okay.
And yeah.
Go ahead.
And you will also get exposure. They come up and we try to give externs the chance to get to observe WADA procedures as they come up, as well as bedside language mappings. These are special epilepsy procedures that you might have the opportunity to see while you're over at the epilepsy center. And then you are going to be, getting inpatient experience at the epilepsy center on the epilepsy unit with cardiac consultations and general medical and neurology consultations, as well as the outpatient experiences, which also have sort of a full range of referral questions as well. And then you would also rotate through the Pearl Barlow Center, which they'll talk more about.
I'll talk more next.
Glad to take over here. So I'm Evan Schulze. I'm one of the neuropsychologists at the Barlow Center. Dr. Safa Shihab is the other neuropsychologist. And we're just down the street from the Epilepsy Center. We're just, I think, like 2 blocks, maybe 3 blocks away. So when attending things like didactics, leaving the Barlow Center to go over to the Epilepsy Center, no big deal. We're all on the same campus. We're all a stone's throw away, which is kind of nice. So the Barlow Center is unique from the Epilepsy Center in that we really are a specialized outpatient clinic for assessment and treatment and management of neurodegenerative conditions. So this really is a specialized dementia setting. So nearly all the patients that are seen in our clinic are typically 50 years of age and older, and referrals are mostly, by and large, coming from our in-house neurologists, which are cognitive neurologists. This is their specialty. And so all that they focus on is neurodegenerative conditions. But we also do have, it's a multidisciplinary clinic where we have geriatricians, we have a neuropsychiatrist. So we're really working as a team. So we do get referrals from those providers as well. So as might be expected in this setting, maybe the most common complaint a patient's going to come in with is I have memory problems, or things just aren't as quick or as sharp as they used to be. So we're often asked to assist with the diagnosis of, is this a subjective cognitive impairment versus an MCI? Is there true objective evidence of cognitive change? And then from there, aiding in diagnostic clarity in terms of etiology. So we do see a lot of different conditions, such as the bread and butter of any neuropsychologist service, which would be an amnestic condition like Alzheimer's disease, vascular related cognitive change, but also lesser seen neurodegenerative conditions such as the primary progressive aphasias, non-Alzheimer's related neurodegenerative processes such as late or part. So it's opportunity to really get exposure to some some of the early but also core syndromes that we see in neurodegenerative disease. And one thing that's also so unique about the Barlow Center, at least from when I started practicing there, is many of the referrals that we've received, they've already had a pretty thorough workup by their neurologist. So oftentimes they'll have advanced neuroimaging. Oftentimes they have PET, FDG PET MRI studies. Some of them may even have amyloid PET imaging or phosphorylated tau imaging. Some really advanced workup. And in those cases, the neurologist is often asking us for assistance and some clarity because sometimes things just don't line up. The syndrome and the imaging and the overall presentation, some things just don't seem to line up. So we're really part of the team in that way to aid in diagnostic clarity, to assist in patient treatment management. So much like the CEC, the Epilepsy Center, we do have students with us 2 full days out of the week. And the way that we run things in our clinic is 1 full day would be for assessment. The other day is for scoring and individual supervision and working on report writing. And right now our schedules are as below. I'm in clinic Tuesdays, Thursdays, and Fridays, and Dr. Shihab on Mondays, Tuesdays, and Wednesdays. So oftentimes when we have students that overlap on those days, we like to do a combined supervision where we discuss our cases together to allow for more exposure to different differentials and starting to think through, what might we expect if we think this individual has an Alzheimer's disease, or if this individual might have Lewy body dementia. So just getting more exposure to that, I think is very helpful from an educational perspective. You can go to the next slide. So in our clinic, each student will be provided with ample space to do their work. We'll make sure of that. And the caseload, the way that it looks, since these are dementia evals, they tend to be briefer than a epilepsy neurosurgical pre-surgical evaluation. So typically the batteries are designed to be 2 hours in duration, maybe even less. So we book our appointments to be 3-hour time slots. And each student that works with us would see 2 cases on one day. And then for their second day that they're in clinic with us, they would choose which case do they want to write up. and which case do they want to have additional supervision on. And we really want the students to feel that they have the freedom to choose. And maybe early on, you might want to start with kind of an easier case to get a feel for our supervision style, maybe something that's a little more straightforward, but with additional presentation of unique cases, we like to encourage you to push yourself. So that provides just more exposure and opportunity for that. And much like Dr. Morrison and colleagues, our reports tend to be brief, for 2 to 3 pages in duration. And we like to have students attend as many feedback sessions as possible for patients that they work with. I think that's such an important aspect of the evaluation. That's our opportunity for intervention, oftentimes. So we always try to encourage that and schedule patients around that. And coming back to what Dr. Morrison commented on previously about virtual appointments, we do no virtual assessments, but we do allow for virtual feedback sessions. So on occasion that does come up. And oftentimes, just given the nature of the patient population, or if an individual is traveling from, say, upstate, just try to make their life easier. So I think that's it from the Barlow Center.
Very good. So as noted, we're not going to have a pediatric placement this year. Dr. Rosenberg is taking a hiatus, but she will be considering having another track next year. So don't write us off, but just not this year. So we will move on then to discussion of our didactics. Dr. Rush.
All right. Yeah, let me give an overview of the didactics. So there are a lot of different opportunities to get more education well, certainly you'll get a lot of didactic exposure to neuropsychology topics, but even in other areas like neurology, both adult and child neurology grand rounds are available on Tuesdays. If you have the time to see them, you can kind of join those if the topic is of interest to you, and they have people from throughout the various divisions in neurology or different departments at NYU presenting, and lots of great guest speakers as well. So that covers the whole range of the lifespan. There are also behavioral health and psychiatry grand rounds that happen on Wednesdays and Thursdays occasionally, and the child and adolescent ones happening on Fridays. So throughout the week, there are various grand rounds that you could attend if you have the availability and the topic is of interest to you. Now, the main didactics for the neuropsych externs are on Tuesdays and Thursdays, like we mentioned earlier, which is why one of your externship days would have to be either a Tuesday or a Thursday. And the lectures covered in this series, again, range the whole lifespan. So we have our colleagues over in psychiatry and the Child Study Center presenting on topics for children and adolescents, so neurodevelopment, and neurological conditions or other conditions specific to that time frame. And then the faculty at the Barlow Center and the Epilepsy Center cover a lot of topics for adults all the way through geriatrics. And it covers a range of topics that is information that will eventually be on the board certification exam. So this is kind of early exposure to some of those things that you will need to know if you're pursuing board certification in neuropsychology. Also part of the neuropsychology didactics, once a month, there are externship or extern level fact-finding exercises, which are done in a group format and proctored by one of the fellows under the supervision of the attendings. And so you get early exposure to kind of the fact-finding exercise, learning how to ask questions and get that information. But that, again, also an essential part of the board certification process and getting that exposure early on. But without the level of intensity of having to do it individually. So good early exposure helps kind of build some of those skills that will be applicable in things like interviewing patients broadly, or how you present information if you were giving feedback. Similar skill development for the fact-finding exercise in terms of just kind of how you're collecting data or how you're summarizing data in a concise and useful way. Next slide.
I'll just mention a final point. The only good thing that COVID brought us was that all of these opportunities are now hybrid. So if you're in one location and you don't have time to get over to wherever this didactic is, you can log on virtually. So, and even if you're at home and that's not one of your days and there's a topic you find of interest, you can log on. So it's a great a point of access for lots of different learning.
Yeah, no, very good point. I will just add to that, if you're on campus and the speaker is there, you're certainly encouraged to attend in person. But there are days where the didactic or the person giving the didactic lecture is also joining us remotely. And so those days you can be joining from either on-site or virtually as well. So a lot of flexibility in terms of that.
So we'll switch. Oh, sorry. So we'll switch to our virtual tour. Nobody comes onto campus anymore to get a sense of what it looks like to be on site. So we took some videos for you, Dr. Resch.
Yeah, so this first video is of an inpatient room on the epilepsy monitoring unit at the hospital. So you can see it's quite a large space. The patient is actively hooked up to an EEG that is being video monitored at the time. So you'd be testing at bedside. You see that little table there. That's usually what you'd use for like writing tasks or presenting stimuli. It has very good views of the city. Some of the East River, some face other parts of downtown. But a pretty sizable and comfortable space for doing inpatient testing. They're all single patient rooms on an epilepsy monitoring unit, so you're not kind of having to work around testing in an environment where there are other patients, kind of being loud and distracting. Although if you're testing in other units, like if we got a psychiatry or general medicine referral in the hospital, that may not necessarily be the case. But certainly the inpatient rooms on the epilepsy monitoring unit are quite conducive to doing testing. So kind of a more modern thing is we have a lot of touchdown spaces throughout the hospital and at Charleston where the epilepsy center is. So instead of having like specific dedicated space, there's a lot more flexibility to kind of move around and do your work from different locations. So that's one of the touchdown spaces in the hospital where you can access anything on the server through the computer. Here's another example of a workroom or a work area over in the hospital where you can kind of touch down, log on onto one of those computers, access anything from our servers. The other nice thing is we have a network desktop. So even from like personal laptops, if you're logging in to Inside Health, which is NYU's network, you can access the server and your personal drive from pretty much anywhere, which really makes it flexible in terms of kind of where you can do your work. But yeah, great views of the city. Here is our main outpatient consult room over in Charleston where the epilepsy center is. So we have dedicated space to do testing there. Kind of more of a traditional office setting. You see kind of in the background a lot of the test materials and there are forms over there. But again, kind of a touchdown space. This kind of gets used interchangeably by the technician, the fellows, the externs, kind of throughout the day as cases come and go. Testing also occasionally done in other rooms in Charleston, other office settings. Again, just lots of flexibility. It's kind of more modern style where there's like less dedicated space because there's so many people competing for limited resources, but a lot of flexibility to be able to do your work kind of from different locations, and quite easily without having to like carry everything over. I didn't mention before, but in the workroom on the unit, there's also testing materials over there. So again, not like you have to like lug everything with you. Being able to access things kind of from any computer makes it easier to just have these touchdown spaces where if you get the testing materials or if you can get onto the server via computer, whether it's a personal laptop or a dedicated space, makes it quite easy to do your work.
Okay, so I'd like to move on to some final details about the training program. Just some dates. Hopefully you all are familiar with the 2025 dates for when the gauntlet gets thrown down and when we all scramble to the wiki site and you submitting and us looking and so forth. Just a reminder, here are the elements of your application packet: a cover letter, a CV, 2 letters, and the lists of tests that you've given, because I know Dr. Abelson mentioned that strong neuropsychology background is helpful. It's not required, and that's a common question that we get. Do you have to have prior neuropsychology experience? No, but I will say that our site is quite dynamic, quite active, requires a lot of cognitive flexibility on behalf of the trainees. So some testing experience definitely confers an advantage and will make your training at a site like ours more smooth. So not required, but definitely it's viewed favorably. People who maybe haven't had a neuropsychology externship yet, but perhaps who worked as a technician in a prior life or for another supervisor or so forth. So that definitely counts as testing experience, because half the battle is sort of just getting the testing under your belt and ready to walk into a room and do the assessment, never mind write the report or do the formulations. So definitely, if you have that background, do consider a site like ours, even if you haven't done a formal neuropsych assessment yet. So all of our interviews will be virtual, and of course, we'll be following all the CIDNIS rules. So those are the dates that we have. And I'd like to just kind of wrap it up and share with you again our faculty.